Question 171. Nurse Peter makes the assessment that which client has the greatest risk for problem with the transport of oxygen from the lungs to the tissues. A client who has A. Anemia, B. An infection, C. A fractured rib, D. A tumor of a medulla. Answer A. Explanation. Anemia is a condition of decreased red blood cells and decreased hemoglobin. Hemoglobin is how the oxygen molecules are transported to the tissues. Option 2 would depend on where the infection is located. Option 3. A fractured rib would interrupt transport of oxygen from the atmosphere to the airways. Option 4. Damage to the medulla would interfere with neural stimulation of the respiratory system. Question 172. Which term does the nurse document to best describe a client experiencing shortness of breath while lying down who must assume an upright or sitting position to breathe more comfortably and effectively? A. Dyspnea, B. Hypopnea, C. Orthonia, D. Acapnea. Answer C. Explanation. Respiratory difficulty related to a reclining position without other physical alterations is defined as orthonia. Question 173. A client with emphysema is prescribed corticosteroid therapy on a short-term basis for acute bronchitis. The client asks the nurse how the steroids will help him. The nurse responds by saying that the corticosteroids will do which the following: A. Promote bronchodilation, B. Help the client to cough, C. Prevent respiratory infection, D. Decrease inflammation in the airways. Answer D. Explanation. Glucocorticoids are prescribed because of their anti-inflammation effect. Options 1, 2, and 4 are not achieved with glucocorticoids. The nurse is planning to perform percussion and postural drainage, which is an important aspect of planning the client's care. The first, percussion and postural drainage, should be done before lunch. Question 174. Nurse Ellery is planning to perform percussion and postural drainage, which is an important aspect of planning the client's care. A. Percussion and postural drainage should be done before lunch. B. The order should be coughing, percussion, positioning, and then suctioning. C. A good time to perform percussion and postural drainage is in the morning after breakfast when the client is well rested. D. Percussion and postural drainage should always be preceded by 3 minutes of 100% oxygen. Answer A. Explanation. Postural drainage results in expectoration of large amounts of mucus. Clients sometimes ingest part of these secretions. The secretions may also produce an unpleasant taste in the oral cavity, which could result in nausea or vomiting. This procedure should be done on an empty stomach to decrease client discomfort. Question 175. Nurse Winona teaches a patient how to use an incentive spirometer. What patient outcome will support the conclusion that the use of the incentive spirometer was effective? A. Supplemental oxygen use will be reduced. B. Inspiratory volume will be increased. C. Sputum will be expectorated. D. Coughing will be stimulated. Answer B. Explanation. An incentive spirometry provides a visual goal for and measurement of inspiration. It encourages the patient to execute and maintain a sustained inspiration. A sustained inspiration opens airway, increases the inspiratory volume, and reduces the risk of atelectasis. Patients who use an incentive spirometer may or may not be receiving oxygen, although sputum may be expectorated after the use of an incentive Iran ratio. That is not the primary reason for its use, although the deep breathing associated with the use of an incentive barometer may stimulate coughing. That is not the primary reason for its use. Question 176. Nurse AJ is applying a warm compress. What should the nurse explain to the patient is the primary reason why heat is used instead of cold? A. Minimizes muscle spasms. B. Prevents hemorrhage. C. Increases circulation. D. Reduces discomfort. Answer C. Explanation. Heat increases the skin surface temperature, promoting vasodilation, which increases blood flow to the area. Cold has the opposite effect. It promotes vasoconstriction, which decreases blood flow to the area. Both heat and cold relax muscles and thus minimize muscle spasms. There is no advantage to using heat over cold. Heat does not prevent hemorrhage. Heat causes vasodilation, which promotes hemorrhage. Both heat and cold can reduce discomfort. Cold reduces discomfort by numbing the area, slowing the transmission of pain impulses, and increasing the pain threshold. Heat reduces the discomfort by relaxing the muscles. Question 177. A practitioner orders chest physiotherapy with percussion and vibration for a newly admitted patient. Which information obtained by the nurse during the health history should alert the nurse to question the practitioner's order? A. Emphysema. B. Osteoporosis. C. Cystic fibrosis. D. Chronic bronchitis. Answer B. Explanation. Implementing the practitioner's order may compromise patient safety because percussion and vibration in the presence of osteoporosis may cause fractures. Osteoporosis is an abnormal loss of bone mass and strength. Option 1. These are appropriate interventions for patients with emphysema. Emphysema is a chronic pulmonary disease characterized by an abnormal increase in the size of air spaces distal to the terminal bronchioles with destructive changes in the walls. Option 3. These are appropriate interventions for patients with cystic fibrosis. Cystic fibrosis causes widespread dysfunction of the exocrine glands. It is characterized by thick, tenacious secretions in the respiratory system that block the bronchioles, creating breathing difficulties. Option 4. These are appropriate interventions for patients with chronic bronchitis. Bronchitis is an inflammation of the mucous membranes of the bronchial airways. Question 178. Nurse Sue teaches a patient about post-sleep breathing. The nurse identifies that the teaching is affected when the patient says its purpose is to A. Precipitate coughing. B. Help maintain open airways. C. Decrease intrathoracic pressure. D. Facilitate expectoration of mucus. Answer B. Explanation. Pursed-sleep breathing involves deep inspiration and prolonged expiration against slightly closed lips. The pursed lips create a resistance to the air flowing out of the lungs, which prolongs exhalation and maintains positive airway pressure, thereby maintaining an open airway and preventing airway collapse. Deep breathing and half coughing, not pursed-sleep breathing, stimulate effective coughing. Pursed-sleep breathing increases, not decreases, intrathoracic pressure. The half coughing stimulates the natural cough reflex and is effective for clearing the central airways of sputum. Saying the word half with short forceful exhalations keeps the glottis open, mobilizes sputum, and stimulates a cough. Question 179. What should nurse Maybe do first if a patient is choking on food? A. Apply shaft or thrust over the patient's sick voice process. B. Determine if the patient can make any verbal sounds. C. Hit the middle of the patient's back firmly. D. Sweep the patient's mouth with a finger. Answer B. Explanation. When a person is choking on food, the first intervention is to determine if the person can speak because the next intervention will depend on if it is a partial or total airway obstruction. With a partial airway obstruction, the person will be able to make sounds because some air can pass from the lungs through the vocal cords. In these situations, the person's own efforts, open parenthesis, gagging, should be allowed to clear the airway. With a total airway obstruction, the person will not be able to make a sound because the airway is blocked, and the nurse should immediately initiate the abdominal thrust maneuver. Thrust to the sigmoid process may cause a fracture that may resound in a pneumothorax. Question 180. Nurse Stephanie is assessing a client who has an acute respiratory infection that puts her at risk for hypoxemia. Which of the following findings are early indications that should alert the nurse that the client is developing hypoxemia? Select all that apply. A. Restlessness. B. Tachypnea. C. Bradycardia. D. Confusion. E. Pallor. Answer A, B, and E. Explanation. Restlessness, tachypnea, and pallor are early manifestations of hypoxemia, along with tachycardia. Elevated blood pressure, use of accessory muscles, nasal flaring, tracheal tugging, and adventitious lung sounds. Bradycardia and confusion are late manifestations of hypoxemia, along with stupor, cyanotic skin and mucous membranes, bradypnea, hypertension, and cardiac dysrhythmias. Question 181. Nurse CJ is caring for a client who is having difficulty breathing. The client is lying in bed and is already receiving oxygen therapy via nasal cannula. Which of the following interventions is the nurse's priority? A. Increase the oxygen flow. B. Assist the client to Fowler's position. C. Promote removal of pulmonary secretions. D. Attained a specimen for arterial blood gases. Answer B. Explanation. The priority action the nurse should take when using the airway breathing circulation approach to care delivery is to relieve the client's dyspnea. Fowler's position facilitates maximal lung expansion and thus optimizing breathing. With the client in this position, the nurse can better assess and determine the cause of the client's dyspnea. Option 1. The client may need more oxygen, as hypoxemia may be the cause of his difficulty breathing. However, administering oxygen and adjusting the fraction of inspired oxygen requires the provider's prescription after a careful assessment of the client's oxygenation status. There is a higher priority given the nature of the client's distress. Option 3. The client may need suction or expectoration, as pulmonary secretions may be the cause of his difficulty breathing. However, there is a higher priority given the nature of the client's distress. Option 4. It is important to check the client's oxygenation status, and in many nursing situations, assessment precedes action, but there is a higher priority given the nature of the client's distress. Question 182. Nurse Aldrin is preparing to perform endocardial suctioning for a client. Which of the following are appropriate guidelines for the nurse to follow? Select all that apply. A. Apply suction with withdrawing the catheter. B. Perform suctioning on a routine basis every 2 to 3 hours. C. Maintain medical asepsis during suctioning. D. Use a new catheter for each suctioning attempt. E. Limit suctioning to 2 to 3 attempts. Answer A, B, and C. Explanation. The nurse must be prepared to provide supplemental oxygen in response to any decline in oxygenation saturation by performing tracheostomy care. The nurse should use a sterile disposable tracheostomy cleaning kit or sterile supplies and maintain surgical asepsis throughout this part of the procedure. Option 3 helps move mucus and contaminated material away from the stomach for easy removal. Option 4. To help keep the skin clean and dry, the nurse should replace the tracheostomy ties if they are wet or soiled. There is a risk of tooth dislodgement with replacing the ties, so you should not replace them routinely. Option 5. The nurse should use a commercially prepared tracheostomy dressing with a slit in it. Cutting gauze squares can loosen lint or cause fevers the client could aspirate. Question 183. A nurse is caring for a client who has a tracheostomy. Which of the following actions should the nurse take each time he provides a tracheostomy care? Select all that apply. A. Apply the oxygen source loosely if the SpO2 increases during the procedure. B. Use surgical asepsis to remove or clean the inner cannula. C. Clean the outer surfaces in a circular motion from the stoma side outward. D. Replace the tracheostomy ties with new ties. E. Cut a slit in gauze squares to place beneath the tube holder. Answer A, B, and C. Explanation. The nurse must be prepared to provide supplemental oxygen in response to any decline in oxygenation saturation while performing tracheostomy care. The nurse should use a sterile disposable tracheostomy cleaning kit or sterile supplies and maintain surgical asepsis throughout this part of the procedure. Option 3 helps move mucus and contaminated material away from the stoma for easy removal. Option 4. To help keep the skin clean and dry, the nurse should replace the tracheostomy ties if they are wet or soiled. There is a risk of tooth dislodgement with replacing the ties, so you should not replace them routinely. Option 5. The nurse should use a commercially prepared tracheostomy dressing with a slit in it. Cutting gauze squares can loosen lint or cause fevers the client could aspirate. Question 184. An elderly nursing home resident has refused to eat or drink for several days and is admitted to the hospital. The nurse should expect which assessment finding? A. Increased blood pressure. B. Weak rapid pulse. C. Moist mucous membranes. D. Jugular vein distension. Answer B. Explanation. All other options are indicated of fluid volume excess. A client who has not eaten or drunk anything for several days would be experiencing fluid volume deficit. Question 185. A man brings his elderly wife to the emergency department. He states that she has been vomiting and has had diarrhea for the past 2 days. She appears lethargic and is complaining of leg cramps. What should the nurse do first? A. Start an IV. B. Review the results of serum electrolytes. C. Offer the woman foods that are high in sodium and potassium content. D. Administer an anti-emetic. Answer B. Explanation. Further assessment is needed to determine the appropriate action. While the nurse may perform some of the interventions in options 1, 3, and 4, assessment is needed initially. Thank you for watching.